Well, hi, everybody. Thank you so much for joining us today. We are going to be talking about Medicare. So to give you a brief overview of what is going to be covered in today's presentation, I want to let you know we are going to start by talking a little bit about the senior linkage line and Trellis, the area agency on aging for the 7-county metro area. My name is Amanda. I am a community outreach specialist with Trellis. And I work with the Senior Linkage Line to bring free information and assistance to older adults, families, and caregivers. I'm joined today by Kelly. She is one of our volunteers here at Trellis and the Senior Linkage Line, and I'll let her introduce herself in a few slides. To begin, I am going to cover Senior Linkage Line. So Senior Linkage Line is a statewide service of the Minnesota Board on Aging. We are housed within the 6 area agencies on aging that covers the whole state of Minnesota, all throughout 87 counties. So anywhere you call in the state, we're able to give this name objective, unbiased, neutral, and free information and assistance. We are experts in health insurance counseling and long-term care options counseling. So if you do need help planning or enrolling in Medicare and comparing plans, we do offer Medicare counseling, one-on-one Medicare counseling. So we will talk about that a little bit more as we go as well, but just know that that's an option because Medicare can be quite complex and confusing. So just know that there is help available. It is important to note that we do not sell, market, promote, or endorse any insurance products. As I mentioned, Senior Linkage Line is free, so we're funded by state and federal dollars through the Older Americans Act. We're neutral. We give you all of the options based on your situation, and then we help you make an informed choice. So we're never going to promote or endorse any product over another. We have many areas of expertise at the Senior Linkage Line. Medicare is one of the big ones. We get a lot of calls about Medicare enrollment options, plan options, especially during open enrollment period. And that's that period October 15th through December 7th. But we also provide a lot of assistance and resources on many other topics as well. So prescription drug expense assistance, long-term care options and counseling regarding housing options, application and forms assistance, caregiver planning and support. We often get the question, do you have to be a certain age to call the Senior Linkage Line? The answer is no. Anybody can call the Senior Linkage Line, and if you're a caregiver caring for a loved one, you can call the Senior Linkage Line for resources and support. We help with healthcare fraud, waste, and abuse. If you have any fraud concerns, please give us a call. And state volunteer opportunities or any general agency related questions. All right, I am now going to hand it over to Kelly, who is going to start talking about Medicare today. So please welcome Kelly.
Okay, thank you, Amanda. As Amanda mentioned, my name is Kelly. I've been a volunteer with Trellis for about 3.5 years now. And I'd like to kick things off by sharing that I think Medicare is like an onion. It's an easy way for me to think about it. There are many layers to an onion, right? And once you start chopping up those layers, it can make you want to cry sometimes, like if you were chopping an onion. But once you start to use it as an ingredient to a main dish, like in this case, Medicare being the main dish, be life, it can really be helpful and is a really important program. And so this overview today, it's going to give you enough information as a starting point to understand Medicare, its costs, and enrollment periods. Medicare can be overwhelming. So very likely not everything that we talk about today is going to absorb, but it will certainly give you a good start, a good understanding of the program and the various options. So I encourage you to contact the senior linkage line as you're looking into your options. It's a great resource to be able to get any kind of specific information that you need that might be unique to your situation. All right, so Medicare, it's a program that's been around since 1965, and it has expanded throughout the last few decades. It's a federal program for basically three overarching groups: people who are aged 65 and older, people under age 65 that have certain disabilities, and then anyone at any age with end-stage renal disease. And over 60 million Americans receive coverage through Medicare, and the number continues to rise, of course, as baby boomers hit that 65-year milestone. And it was never a program it was never intended to cover 100% of medical expenses or long-term care services. So, as we go through this Medicare 101, you'll see where those gaps exist. But we'll also talk about options to help support those coverage gaps. Okay, well, Medicare, it's made up of four main parts. You have Part A, Part B, Part C, and Part D. Part A, this helps pay for inpatient hospital stays, and it also helps cover some skilled nursing care, home health care, and hospice care. Part B helps cover medically necessary services like your doctor's visits, outpatient care, does include some preventative services like some screening tests, diagnostic tests, some therapies, and durable medical equipment. And this is what's known, Part A and Part B, as Original Medicare. And so what's not included there in Original Medicare is drug coverage. So I'm just going to skip to Part D, which is Medicare drug coverage that helps pay for outpatient prescription drugs. Now, moving back to Part C. Part C is another way to get Medicare benefits. It's known as Medicare Advantage plans. So it basically combines your Part A, your Part B, and in most cases, your Part D. So it's essentially a bundled plan or an all-in-one plan. These are offered by private insurance companies that are approved by Medicare, and the plans have to cover medically necessary services, but you can be charged different co-payments, co-insurance, or deductibles for these services. So there are just over 1 million Medicare beneficiaries in Minnesota, right? We have a population of almost 6 million. And there are really basically two overall options or paths, if you will, that you can take with respect to Medicare coverage. So option one, that's what we're going to cover first. That's Original Medicare. So we talk about our Part A and our Part B. And that's administered and run by the federal government. It's sometimes also referred to as Traditional Medicare. And then option two is a Medicare health plan. So on the left there, we're talking about Medicare Advantage plan, right? That's your Part C that we talked about just a minute ago. Part C, again, it combines your Part A, your Part D, usually Part D into one plan. It has provider networks, whereas Original Medicare, first option, does not. So in the first option, you can go anywhere that accepts Medicare, but Medicare Advantage has provider networks. On the right there is Medicare cost plans. So it's not part of Part C, but I'm going to put it out there because there are some Minnesota counties where you can have a cost plan. And we'll talk through what that looks like. So just under half of Minnesota beneficiaries have one of these types of plans. So both options are available, whether you go the Original Medicare route or your Medicare health plan route. It's just about determining what's right for you. Now, one thing I want to mention is sometimes you might hear Medicare Advantage plans in advertising or whatnot mentioned as a supplemental plan. I'm not going to call it a supplemental plan here because a Medigap, which we'll cover later, is actually called a supplemental plan. So in terms of this presentation, you won't hear me connect supplement to Advantage plan. All right, so first we're going to talk through our option one, as I mentioned, original Medicare, and we're going to start with that Part A, hospital. So Part A has coverage for the services you see on the screen here, but it's important to note that in some cases you do have to meet pretty stringent criteria for coverage. So with inpatient hospital coverage, in general, Part A will pay for inpatient hospital stays, but only when you're admitted as an inpatient. So if you're under observation, that is where they're just monitoring you and you haven't been formally admitted, Part A will not cover this, and that has cost implications. That's covered under Part B, which we're going to talk about in a bit here. Skilled nursing facility coverage. So to receive this kind of coverage, you have to meet some requirements, and your needs have to require daily skilled or rehab care, in the skilled nursing facility. So generally for Part A, skilled nursing care immediately follows a hospital stay. And the services have to be pretty complex, that they can only be safely and effectively performed by a licensed professional. Then we have home health care. Again, some stringent requirements here. You have to be homebound, which also has to be certified by a physician. There has to be a plan of care developed with your treating physician, and you have to receive intermittent skilled care. One thing to note here is that Minnesota does have a limited number of Medicare certified home care agencies. Most are not Medicare certified, so just be aware of that for this coverage. With hospice services, we'll get into what the cost sharing looks like on the next slide, but just note that room and board are not covered. Also, blood coverage is covered under Part A as well. So when we look at the cost sharing for Part A, most people on Medicare do not pay a Part A premium when you start Medicare Part A. Essentially, you've paid it through your payroll taxes, either you or your spouse, and that would mean that you or your spouse would have had to work at least 40 quarters, which is basically 10 years of work, and that fits the bill for 95% of people. But if you or your spouse haven't worked those 10 years, then you would have a monthly premium. So for most people, no premium. However, you would have a deductible, and it isn't just like an annual deductible. It's based off what's called a benefit period. And so that payment that you see, that $1,556, that's the deductible for 2022, that would be required at the beginning of each what they call benefit period. And the benefit period begins the first day that you're an inpatient into the hospital, and it ends when you're out of the hospital or not receiving skilled care for 60 plus consecutive days. So I'm going to share a scenario, which can be confusing, but hopefully you can follow along as best as you can here. Let's just say you're in the hospital, admitted as an inpatient today, and you go home 10 days later. But then you need to go back to the hospital, let's say 30 days after that, for an additional 5 days, whether it was for the same reason or a different reason. In that scenario, you would not have to pay another deductible because you did not spend more than 60 consecutive days out of the hospital before returning home. So you'd be in that same benefit period. So in the scenario I just described, you basically spent 15 days total in the hospital, and you would not pay any coinsurance there, just the deductible. Now, if you happen to have a longer stay where you're staying in the hospital for 61 or more days, the cost sharing switches to a coinsurance, as you can see there, and then days 91 through 150 is also a co-insurance, and those are actually lifetime reserve days. So that's only available once to you if you happen to have a lengthy stay like that. Otherwise, it would perhaps be out of pocket for you. So just to recap, you can have multiple Part A benefit periods in the same year. And so Part A benefit periods do not start with a new calendar year. I think that's what a lot of us are used to when we think about deductibles, them being on an annual basis, but not in the case of Part A. For skilled nursing facility coverage, again, some stringent requirements here, but just know if you meet that, the first 20 days are covered, and then there's a daily co-insurance after that. And for 2022, that's $194.50 for those days 21 through 100. After day 100, if you are unfortunate enough to have that situation, then of course it may be out of pocket or wouldn't be covered under Part A. Home health care. So this coverage, as long as you meet the requirements, it's going to be covered under Part A. Sometimes, and we'll talk about Part B next, sometimes this can be covered under Part B as well. But typically, if it follows a hospital stay, it would be covered under Part A. I mentioned hospice services, so it's covered here for the most part. You can see there are some small charges there for prescription drug, pain relief, that type of thing. But the biggest thing here is that the room and board part is not covered. And your blood coverage is covered after the first 3 pints, unless someone or a blood bank does donate on your behalf there. So that is Part A. And now we're going to talk about the other half of original Medicare, which is Part B. So Medicare Part B, it has coverage for, what you see on the slide. So physician services, outpatient hospital services. Remember, we talked about inpatient. This is outpatient, so when you're under observation in the hospital. Some preventative services, your ambulance service, home health care in certain areas versus where it might be covered under Part A. Therapy. Medicare Part B does have some limited prescription drugs. We'll talk about that. But for the most part, prescription drugs are covered elsewhere. You can have blood coverage under Part B as well, lab services, durable medical equipment. And then actually, sometimes there are new things that are added, like in 2020, acupuncture is covered for lower back pain if you meet the requirements there. So when we look at cost sharing for Part B, you've got to pay a monthly premium. So that's something different than Part A. An annual deductible. So that's also different from Part A. And co-insurance for most services. So for 2022, the standard monthly premium is $170.10. That can change every year, and often does. And the annual deductible is $233, and that can change every year as well. So in general, after that deductible has met, Medicare typically covers 80% of the costs, and you would be responsible for 20%. That's in general. In some cases, it's a little bit different, which you can see on the screen there. Just like any insurance program, it's important, before you enroll, just take a look at the fine print. I just want to give you a couple examples here. So when we are talking about ambulance services, Medicare Part B, it will cover your ambulance service in emergency situations and if your health is in serious danger, but it will cover you to the nearest medical facility that's able to give you the care you need. So if you want to be transported to a facility farther away, Medicare's payment is going to be based on the charge to the closest appropriate facility. So fine print. Durable medical equipment. Here it's just important that you purchase from a Medicare participating supplier, because not everybody participates in Medicare, and you don't want any Surprise charges because you didn't purchase it through an approved participating supplier. Home health care, again, similar to Part A, there's generally no cost sharing here, but you do have to meet some pretty stringent requirements. Okay, so limited prescription drugs. Wanted to mention here, typically, if a drug's going to be covered under Part B, it generally is given to you at a doctor's office or in an outpatient setting. So some examples of Part B drugs that would be covered would be, some vaccinations. Some actually are covered at 100%, like the flu shot. Any drug that might be infused through durable medical equipment, so like an infusion pump, nebulizer, basically, and sometimes even oral cancer drugs as well. So the biggest thing here is, to be your own advocate when it comes to wanting to make sure there are no surprise charges coming your way. Not sure what I clicked there. Okay. All right. So here we have on the screen some outpatient services that do require prior authorization. These services you used to be able to get without a prior authorization, but beginning in 2020, Medicare did require these to have approval. And this pre-approval, I should say. This change was made because the Center for Medicare and Medicaid Services, or CMS, they saw a significant increase in the number of these services being performed. So this is not the full list, but many of these procedures that can be found on this list could be considered cosmetic. So that's why they're wanting prior approval to ensure that there's a medical reason. And then here are some services that original Medicare, again, A and B, did not cover, which is actually surprising and does come as a surprise to some people. So some preventative services are covered right at 100%, but they do have stipulations around like how often you receive them. So like a colonoscopy, for example, you can have one covered every 120 months or every 24 months if you happen to be high risk. But there's a welcome to Medicare preventative visit, but that's not a full physical, which, with other insurance, you might be used to having being covered. There's an annual wellness visit. So there's just some things that are a little bit different, but you can see like hearing aids, dental services, routine eye exams, and eyeglasses. These are not covered under Part A and B. Most care while you're traveling outside of the United States is not covered. Long-term care and routine foot care. So this does come as a surprise, but we'll talk about some options here as well. Okay, so we just covered option 1, original Medicare. So your Part A and your Part B. And as we walked through original Medicare, you probably noticed and it does not cover everything, as we were just talking about, but you do have the option of adding additional coverage. And so I'm going to start with explaining Medigap policies. So that's optional coverage, and it helps you pay for out-of-pocket costs that are not covered by original Medicare. So Medicare policies, they cover the gaps, which I think is probably where the name came from, in original Medicare A and B. It's also known as a supplement plan. I referenced that earlier, so here's where we would be referencing supplement plan. It's not a way to get benefits. It's a way to help pay for your original Medicare benefits. There are several types or like tiers of Medigap policies, which cover different costs. It usually covers the co-insurance for most Part B services. So that 20% that Medicare does not cover, it usually will cover that, depending on which type of Medicare or Medigap you have. It does not cover prescription drugs, except for in some cases, the cost sharing of the Part B drugs, where Medicare would cover 80% for that and a Medigap policy may cover the 20% there. These are sold by individual insurance companies that are licensed in Minnesota. So in Minnesota, I think there's 20 Medigap insurers. And similar to Medicare Part A and B or original Medicare, there's no network. So you can use it with any provider that accepts Medicare. One big thing to note here is that Medigap policies are standardized. So the differences you're going to see are in the premium costs or perhaps the level of customer service. And there can be some really big differences in those premiums that different insurance companies are charging for the same coverage. So be aware of that. And also, I think one of the most important things to know is what's called the 6-month guaranteed issue period. This is when a Medigap company can't health screen. They call it underwriting. And they can't deny to sell a policy to any beneficiary, no matter what their health condition is. Okay, so that 6-month begins when you enroll in Part B, and it ends 6 months after. And after that 6-month enrollment period ends, a company can refuse to sell you a policy or could health screen for your health background. Okay, so be aware of that. You have a shorter window here without any type of health screening if you do decide that a Medigap is right for you. In general, if a beneficiary moves out of state, they may not have to change their policy, right? Because it travels with you, but premium costs can rise if medical costs are higher in the new state. All right, so still no provider networks. One thing to note too, Minnesota is what's called a waiver state for Medigaps. So your Minnesota mandated benefits may not be covered if you move out of state. So what that means, with Minnesota being a waiver state, is that the policies for Medigaps in Minnesota, they exceed the federal standards, which were enacted in the 1980s. So the policies didn't change to the federal guidelines, and a waiver was granted because they actually exceeded the federal guidelines. And so the policies in Minnesota actually have additional protections for policyholders, and they also have state mandated benefits that aren't available in other states. So those are the things to know if you are moving or want to move out of Minnesota. All right, so here now are the Medigap policies that are available in Minnesota. So you have your basic and your basic with riders. And so those would cover like your Part A and B co-insurance, right? That 20% we talked about, home health care and hospice co-insurance, and some other services as well. If you add a rider to your basic policy, it may include like your Part A deductible coverage and things like that. So that's something to look into. And then there are also additional plans that have limited coverage. So it might have 50% coverage or 50% of Part A deductible coverage. So sometimes these will cost less, but you'll get less help paying for that. The extended basic, oh, forgot to cover that one. That's kind of like the Cadillac of Medigaps. So it gives you the most help paying for things, but typically it will cost the most. So it includes like your basic, your riders, and additional coverage. And you see those letters, the K, L, M, N. That just shows you, so Minnesota likes to call their plans something different, right? Because we have some additional inclusions with our coverage. The letters are, it's based kind of this alpha process, and that's federal reference there. So it's just a reference to the federal Medigap policy standards. So you'll see some other things there. Retiree supplement coverage. Sometimes people have retiree supplement coverage that acts as a Medicare or a Medigap would, helping to cover some of the gaps that original Medicare does not cover. So if that fits you, definitely talk with your employer or your former employer about what that will cover for you. And I'll just throw out again, Medigap policies are standardized in the benefits. So for example, if you're looking at an extended basic policy sold by one insurance company, and you're looking at an extended basic policy sold by another, your premiums might be different, but the coverage is standardized. The benefits are standardized. So look for that, because those costs can really vary. And then, Medigap coverage, it doesn't change unless it's mandated by law. But the premiums for Medigap policies, those typically do change over time, typically increasing over time. So just something to be aware of. Okay, so now we've covered original Medicare Part A and B, the optional coverage of a Medigap policy, but these don't cover prescription drugs, with the exception of some in Part B that we covered. So that's where a Medicare Part D plan can be beneficial. So a Medicare Part D plan, most of the prescription drug coverage here would fall under a Part D plan. For 2022, there's actually 22 options or Part D plans to choose from in Minnesota. And the monthly premiums can range from about $6.80 to over $116. So quite a bit of variance there. All Part D plans, they have to offer a standard level of coverage. That's defined by Medicare. But some may also offer enhanced benefits. And each one's going to have a different combination of what it covers, what drugs it covers, and the cost sharing to you. But as a general statement, Medicare Part D, it will cover generic and brand name drugs, not all of them, but medical supplies that are associated with the injection of insulin. So that would be things like syringes, alcohol swabs, gauze, and also does cover insulin, but at varying costs to you. So keep in mind, coverage and costs differ between the plans and for your situation. So each plan is going to have a list of drugs that it's going to cover, and that's important because the plan's going to tell you the names of the drugs, how much you're going to have to pay, and if there are limits or restrictions on your ability to get the drug. So whether it be like a 1-month prescription or there's limits on quantity, things like that. It is not mandatory to enroll in Part D, but if you don't have creditable drug coverage as good as a Medicare Part D, and you decide later to enroll in a Part D plan, you may have a premium penalty that increases each year. So that's a penalty that lasts a lifetime. So when you're first looking at drug coverage, make sure that either you have creditable drug coverage, let's say maybe through maybe you still continue to work and you have it through an employer, but it's going to be called out whether it's creditable drug coverage or not. So keep in mind when you're looking at your Part D and other drug options. One thing I want to mention here, and this is a new program that plans could opt into starting in 2021. It's called the Senior Savings Model. And this can really benefit beneficiaries who have diabetes. So plans that opt in, they're able to get a wide range of insulin medications, and a 30-day supply would cost no more than $35. So 1 in 3 Medicare beneficiaries, they have diabetes. So this model, the Senior Savings Model, was designed to offer insulin at an affordable but also a predictable price. Okay, and so when you look at Medicare.gov and you're looking at your different options, and I think Amanda is going to touch on what that plan finder looks like later, This is a sortable option. You can include that requirement as part of that. Minnesota also has an additional program where Medicare beneficiaries could be eligible as well. It's called the Continuing Need Program, something to look into if you do have insulin or diabetes and need other resources there. Okay, so Medicare Part D, so it has 4 coverage phases: your deductible phase, your initial coverage phase, your coverage gap phase, and then your catastrophic coverage phase. The phase is going to be determined by the plan and your total medication costs, where you fall into for each of those phases. Not all plans will have a deductible phase, right? So we'll confuse you even more. Not all plans have a deductible phase. And then plans that have a deductible phase, they may choose to offer certain medications like generics at a lower price during the deductible phase. So as a blanket statement here, these plans are going to be very different in cost and structure, even though they're within these phases. And so it's going to be important to look at your current prescription drugs and how it relates to these plans and what's covered. Okay. Again, that Plan Finder tool, which Amanda will talk about, is going to be really helpful to you. Also, contacting the senior linkage line. The specialists there are great at helping walk you through what can be a confusing part of Medicare. So this chart here, this shows the Medicare Part D benefit as it exists for someone who doesn't qualify for any extra financial help. So you'll see that little no extra help, LIS. Amanda's going to cover that later, but this would be for someone who doesn't qualify for that. So again, you've got that deductible phase, right? So for 2022, a plan's deductible, it can't exceed $480. You may pay up to 100% during this phase, but depending on the plan, you may not. Costs are going to vary widely for this phase. For the initial coverage phase, so it's kind of that teal blue color there. During that phase, you may pay 25% or less for your prescription drugs. So your payments will vary here, as drugs are going to be grouped into different tiers. So like if you have a tier 1 drug, which might be generic, you're probably going to pay way less than 25%. So there's a whole host of tiers, which adds to the confusion, but also why there's some really great tools to help you figure that out, as including the senior linkage line. So after your drug costs, if it reaches $4,430, and that would include what you pay and what the plan pays, you then reach that gray box there, gray kind of row. That's what's called the coverage gap phase. So in here, you're gonna pay, like if you were paying less than 25% for a drug previously, you're now gonna pay 25%. That coinsurance is gonna go up. And then once a person reaches their out-of-pocket limit, you're eligible for catastrophic coverage. And so that is that green box right there. So a little confusing here. Part D is confusing. There's no way around it. But the specialists at the senior linkage line are definitely able to help you navigate that in an unbiased way. And then also just there's some really great tools that Amanda is going to talk about and resources that are available from Medicare. All right, so now that we've talked about Part A, B, and D, I do want to mention here that there is additional cost for premiums for both Part B and Part D if you make a higher income. And the threshold they're going to take is based off the filing from 2 years ago. So it's called the Income Related Adjustment Amounts, or IRMA. And And this is pulled from your modified adjusted gross income. Kind of getting in the weeds there, but just to kind of give you some background on how this is pulled. If your situation has changed, like because 2 years ago, your financial situation might be very different than it is when you're applying for Medicare. There are certain times that you can appeal this. Let's say your tax return was inaccurate. Maybe there's been a life-changing event like a death of a spouse, marriage, divorce, work stoppage, loss of income, reducing property. So these are things that you may be able to appeal, and the Senior Linkage Ally could certainly guide you in the right direction if that is something you're interested in looking into. All right, so we've covered option 1, right? Your A, your B, your optional coverage, Part D, prescription drugs, and also we covered Medigaps as optional coverage. Now we're going to move on to that second path that we were talking about with respect to Medicare, and that's a Medicare health plan. So on the left there, again, Advantage plan, that's your Part C. So it's a bundled plan. It includes usually Part A, B, usually D, and additional benefits. And so we're going to start, we'll talk about cost plans too, but we're going to start with Advantage plans, otherwise known as Part C. One thing I want to mention before we move on to the next slide, you do need to actually be enrolled in Part A and Part B, right, to get an Advantage plan, to enroll in an Advantage plan, because an Advantage plan includes your Part A and B. So you actually have to be enrolled in that before you can, get an Advantage plan. So that means you're still going to have to pay a Part B as in boy premium on top of whatever premium you pay for your Advantage plan. So just something to keep in mind there. Okay, so Advantage plans, as I mentioned, they're offered by private insurance companies. These are all approved by Medicare, and it covers everything that original Medicare would cover, but also has some additional coverage benefits like vision, prescription drugs, and dental. Each plan will vary what it covers, but those are some examples. And plans are going to have, different rules, costs, restrictions, and whatnot. With Medicare Advantage plans, there are premiums, deductibles, co-payments, and co-insurance, right? But all plans have an out-of-pocket maximum for your Part A and B. So within your bundled Advantage plan, for those 2 sections, you have an out-of-pocket maximum, right? So the cost sharing is going to look different than original Medicare, whereas you might have needed a Medigap to help coverage that. This is going to have a cap on it. So your costs, you will know the most you're going to pay for those Part A and B services in an Advantage plan. One difference here is that you do have to use a network provider for your full benefits and payments to be made. So if you go out of network, typically your costs are going to be higher, but each plan is going to tell you what that cost is if you go out of pocket, or out of network. And although you're going to be billed through your Advantage plan now, you're still going to, again, have to pay that Medicare Part B premium because you're signed up for now A and B. And just as a reminder for 2022, that's just over $170. So talked about, it's got an out-of-pocket maximum. Therefore, you don't need a Medigap, and you can't get a Medigap if you have an Advantage plan. Can't have one. All right, so for 2022, there are a whole host of choices to choose from for Advantage plans. The key is just going to be to do your homework on these plans. Again, the Senior Linkage Line is here to assist. There's also these great resources, which we'll talk about. And but it's just important to know, like a health maintenance organization or an HMO plan, that's one example. Even 2 examples, HMO plans, they may not work the same way. So it's just important to understand the specific plan's network rules, the restrictions, and the costs. One example too, some Advantage plans have a $0 premium, right? Some have maybe $150 per month premium, but those premiums are offsetting or not offsetting perhaps other costs within your plan. So even though a $0 premium plan, it could be a great option for you, just look into the plan because your out-of-pocket costs may be higher in that type of plan. Most Medicare Advantage plans, as I mentioned, they offer, a Part D prescription plan. You can't actually have a standalone Part D plan in most cases with Advantage plans because, again, it's bundled. But there are some exceptions there, and that exists within the private fee for service type of plan and the Medicare Advantage medical savings account. So those are some different plans where you may have exceptions to have a standalone Part D. Okay, so that was a brief overview of Advantage plans. Again, what's known as Part C. Did want to briefly touch on Medicare cost plans within this option too. And this exists only for some counties in Minnesota, and I'm going to pull that up now. So here's a list of counties that offer plans in 2022. This can change each year depending on the requirements with Medicare, but this is for 2022. And basically, it is an option in these counties that can still receive this type of plan. It's somewhat of a hybrid, so a cross between original Medicare and an Advantage plan. And so plans have a network, but you can see providers outside of the network and then use your original Medicare, right? So it's kind of a hybrid. If you reside in a cost plan county, just highly recommend contacting the senior linkage line to understand your full options, because you do have a few more decisions to make than you would if you didn't live in one of those counties. All right, well, I'm going to send it back to Amanda now, who's going to dive into things to consider when you're deciding on which path is right for you, whether that's that option 1 or option 2 and your additional coverage. She's got some great information for you. So I'm going to send it back to her.
All right. Well, thank you so much, Kelly. And yeah, so we are going to talk now about these two different options. So Kelly went over these two different options, and you may be thinking, well, which is the best option, right? We get that question a lot. And there's no real easy answer for that because these two options are just different. So it's really based on your personal situation. And so what you're going to want to do is take a look at these two options and compare the cost, convenience, and coverage. And that's something that Senior Linkage Line can do with you as well. We do offer those one-on-one Medicare counseling appointments, and this is something they can go over with you. But when we're taking a look at option 1 compared to option 2, so remember that option 1 is that original Medicare plus a Medigap and possibly a Part D prescription drug plan. You're looking at higher premiums and lower out-of-pocket costs. When you're looking at option 2, those are those Medicare health plans, Medicare Advantage or Part C, or a cost plan. You're going to be looking at lower premiums or higher out-of-pocket costs. With option 1, there are Medicare covered benefits, right? You can go and receive your care anywhere that accepts Medicare. Whereas in that option 2, usually you're going to have, network providers, right? So you have to stay within the network in order to be able to receive your care. With option 1, there are certain Medicare covered benefits. So, it's standardized throughout the original Medicare, and those are the benefits you receive, no additional benefits. Whereas in a Medicare Advantage plan, there may be additional benefits. We talked about, hearing, dental, vision, or transportation even. It depends on the Advantage plan. So if some of those benefits are important to you, that's something that you want to take a look at. With option 1, with that original Medicare, you can purchase a standalone Part D plan. With your Medicare Advantage plan, it may or may not include prescription drug coverage. And if it does not, you cannot purchase that separate Part D plan. So if prescription drug coverage is important to you, you want to make sure that that's included in your plan. With that original Medicare, if you are going to be purchasing a Medigap policy, once you enroll in Medicare Part B, it's going to trigger that Medigap open enrollment period, that guaranteed issue period that Kelly mentioned a little earlier. That means you have that 6 months to enroll in a Medigap policy without being subject to a health screening. With our option 2, our Medicare Advantage plans or cost plan, they're not going to ask you for a health screening. So they can't deny you that plan based on a health screening. Okay, so these are some things that you might want to compare when you're looking at what option might be best for you. All right, some other things to consider, when you're going back and forth between original Medicare and Medicare Advantage. If you stick with the original Medicare, are you going to purchase a Medigap policy? Do you need Part D, or do you have a different creditable drug plan? Remember, as Kelly mentioned, if you do not have a creditable drug plan and you choose to not enroll in a Part D plan when you first become eligible, you may be subject to penalties later down the line. Okay, so something to keep in mind. Can you afford the premiums? Of course, very important. And do you have employer group health insurance coverage? We're going to talk about in the next couple slides why that might impact your decision. With a Medicare Advantage plan, do your providers participate? It might be important for you to continue to see your primary care provider. With a Medicare Advantage plan, you usually have to stick within their network. So make sure your provider's within that network. Are your prescription drugs covered? Like we mentioned, prescription drugs are not always covered within a Medicare Advantage plan. Is there coverage if you travel? With a Medicare Advantage plan, that plan then becomes the payer of all your services, and you can't use original Medicare if you are traveling outside of your network. So do you need coverage for travel time? Okay. Does the plan have extra benefits? Okay, even though Medicare Advantage plans do offer additional benefits that original Medicare may not all plans do include those benefits. Okay, and of course, again, can you afford the premiums and cost sharing? All right, so now, we've talked through the options here, and the question now is, when do I enroll in Medicare? Okay, so Kelly mentioned that you first become eligible for Medicare when you turn 65. But when you're coming up to that birthday and you're, when you're going to be turning 65, it's important to ask yourself, do you have health insurance through a current employer? So you're still working, you're coming up on your 65th birthday, and you still have health insurance through your current employer or your spouse's employer. Okay, so it could be you or a spouse. If the answer is yes, if you do have health insurance through your employer, you have to ask yourself a few more questions. Do you work for a small employer? Okay, so a small employer is 20 or less employees. That is not considered creditable coverage. Okay, and you wouldn't then be able to delay your Medicare Part B. Do you contribute to a health savings account? We'll also talk about in just a slide or two here why that's important. And it's also important to note when that coverage will be ending so that there are no gaps in coverage. If you do not have health insurance through a current employer, then you do need to enroll in Medicare when you first become eligible, when you turn 65. If you are already receiving Social Security benefits or railroad retirement benefits, you're automatically enrolled in Medicare Part A and B. If you are not receiving those benefits, you do need to enroll yourself. So contact Social Security to enroll. All right, so we mentioned, to stop paying those health savings account, or if you are contributing to a health savings account, it is important to know that you should stop those payments 6 months prior to beginning your enrollment in Medicare. The reason being is that if you don't stop those payments, you could face a pretty stiff tax penalty from the IRS. You can still use, so if you have money in that health savings account, you can still withdraw money and use the funds in that health savings account, but you cannot be contributing to that HSA or health savings account 6 months prior to your enrollment. Now, if you do have what's considered creditable coverage through your employer, so that's 20 or more employees, you can delay your enrollment in Medicare Part B. Now, why you may want to do that is if you enroll in Part B when you do not need the coverage, you could lose your employer-based group health insurance. You would be paying a monthly Part B premium when you don't need to be paying the premium. And it also triggers that Medigap open enrollment period. During this time, if you have other coverage as well, you might not need that Medigap, and you might lose that opportunity to enroll in a Medigap policy without being subject to a health screening. In regards to your group health insurance and COBRA, so COBRA benefits are not considered creditable coverage when it comes to being able to delay your Part B. So you would be still subject to a Part B premium penalty if you delayed your coverage with having COBRA benefits. Now, if it is a prescription drug plan, that might be considered a creditable drug plan, and you may or may not need to enroll in a Part D plan. The best thing to do in this situation is to talk to your employer, talk to your benefits department, and figure out whether or not it is considered creditable coverage. Now, if you do have that group health insurance and you do end up delaying your Part B coverage, when you or your spouse decide to retire, it will trigger an 8-month special enrollment period. During this special enrollment period, you can then enroll in your Medicare Part A and B and decide whether or not you're going to purchase a Medigap or a Medicare Advantage plan. Okay, so there are many different Medicare enrollment periods. The first one that we're going to talk about here, and we'll talk about this one a little bit more in depth on the next slide, but this is the initial enrollment period. This is when you first become eligible for Medicare. Okay, so again, that's when you turn 65. There's also the general enrollment period, which takes place January 1st through March 31st of each year. When that happens, if you enroll any time during that time, Medicare is going to start, your plan will come into effect on July 1st of that year. So there would be a delay in coverage. And a lot of times when you're using this general enrollment period, you may be subject to some penalties because either you didn't use your initial enrollment period when you were first eligible, or you missed your special enrollment period as well. Okay. If you do incur a penalty on Part B, that is for life, and it does increase every year that you did not have Medicare Part B when you should have had Part B. Okay, so it can be a pretty stiff penalty. Open enrollment period is October 15th through December 7th of each year. This is for if you are already enrolled in Medicare, you should take a look at your plan each year, review your plan, make sure everything is still working well for you, and make changes if you need to make changes. Anything that you change during that time takes effect on January 1st of the next year. Certain things will trigger special enrollment periods, so certain circumstances that might qualify you. So the ending of group health insurance, or let's say you move to a different state, things like that. And then there's also a relatively recent enrollment period called the Medicare Advantage enrollment period. So this is January 1st through March 31st of each year. And during this time, you must start the year on a Medicare Advantage plan, but you can have an additional period of time to make changes, either return to original Medicare or enroll in a different Medicare Advantage plan. All right, now I mentioned we were going to take a look at this initial enrollment period. And so we are going to look here. It's the 7-month period surrounding your 65th birthday. So 3 months prior to your 65th birthday month, the month of your 65th birthday, and the 3 months following your 65th birthday. You can enroll in Medicare anytime during this 7-month period. However, when you do enroll, does make a difference of when your coverage will begin. We're going to take a look at that on the next slide. So you can see here, anytime you enroll in Medicare the 3 months before your birthday month, that coverage will begin the first day of your birthday month. If you enroll during your birthday month, your coverage will begin the first month after your birthday month. And then the first month after, that coverage will begin 3 months after your birthday month, and so on. So you can see that this delays your coverage quite a bit. The second month after, it's a 5-month delay. The third month after, there's a 6-month delay. The good news is I believe that starting in January of 2023, when you enroll during one of the months following your birthday month, your coverage will begin on the first day of the next month. So I believe that's something that's coming 2023. If you are on Social Security disability, your enrollment period looks very similar to the 65th birthday enrollment period. So 3 months prior to the 25th month of Social Security disability, the 25th month, and the 3 months following Social Security disability, or the 25th month of Social Security disability. So this is an example of your Medicare card. Once you enroll in Medicare Part A and B, you will receive this card in the mail. If you are going to be delaying that Medicare Part B, you're going to want to send this card back. You want to keep your card in a safe place. So you never want to give out your Medicare number if you don't know who's asking for it or why they're asking for it. Only use this to show your enrollment in Medicare if you're going to a doctor's appointment. And this card is specifically for Medicare Part A and B. If you enroll in a Medicare Advantage or a Part D prescription drug plan, you will be issued a separate card. And this card doesn't replace a Social Security card. Used to be a little bit more confusing because that number, the Medicare number, was your Social Security card, but now it's a Medicare beneficiary identifier. So not your Social Security number, and it does not replace that Social Security card. So you still want to keep it in a safe place though, and protect that information. Okay, so we've talked all about the different options of Medicare, when to enroll in Medicare, if you should enroll in Medicare, but we've also talked about some of the costs of Medicare, and we know that sometimes it can be expensive. The good thing is there is help available. So the Extra Help program that Kelly mentioned when she was talking about the Part D plans is help for your prescription drug coverage. If you are on medical assistance, you are automatically eligible for the full Extra Help. So that helps significantly with your drug costs. So no premiums, no deductibles. But there is also a partial Extra Help program that you can apply for through Social Security. This is income-based. So, you may or may not meet those income guidelines, but something to note about this program is that it is a very underutilized program. There are many people who are eligible for this program in Minnesota, but they have not applied either because they don't know it's available or they think they might not be eligible. So it's a very easy process to apply for this program. And, I always say the worst that can happen is you're not eligible. But if you are, it does reduce your prescription drug costs, reduces those premiums, reduces the deductible. So that program there is through Social Security. There are also Medicare savings programs that you can apply for through the county. These are also income-based. If you need assistance with these, you have questions about what the income guidelines are, please feel free to give Senior Linkage Line a call. We can help you with that. A lot of times, we can't fill out the application for you, but we can help you to know what you might need for that application, where to find that application, and where to submit that application. Medical assistance, there are extra help associated with Medicare costs. So medical assistance is what we call it in Minnesota, Medicaid throughout the country. So there is extra help available with that as well. Here's an example of that full extra help for Social Security or through Social Security. So you can see, if you are eligible for that extra help, you remember that chart that you saw earlier for the Part D costs and those phases when Kelly was talking about the different phases of Part D. We have none of those. We have, no deductible, no premium, no monthly cap on copays. And then once we reach that catastrophic coverage phase, there's no copays. So looks very different and can help significantly with your drug costs. Okay, so you have some decisions to make. And these are not always easy decisions. So, I will say it again, Senior Linkage Line is a great place to get resources and to get support. But some of the decisions that you're going to have to make are, first of all, your enrollment. When are you going to enroll, or should you enroll when you're first eligible? How are you going to get those Medicare benefits? Are you going to choose option 1? And if you choose option 1, do you need Medigap policy? If you choose option 1, do you need to purchase a standalone Part D prescription drug plan? Or are you going to choose option 2, that Medicare Advantage plan? Or if you live in a county that offers a cost plan, maybe a cost plan. And then you're always going to want to do an annual review of your coverage. So when open enrollment comes around, remember that open enrollment period, October 15th through December 7th, you want to take a look at your plan. Have there been any changes? If you get changes in your plan, you'll receive that in the mail. Are your providers still in your network? Can you still afford the premiums? You want to do that review every year, even if you think things are working well for you. It's always beneficial to review that plan. All right, where to go for help? We say it over and over, but Senior Linkage Line is a really great resource. 800-333-2433. Senior Linkage Line is available Monday through Friday, 8 a.m. to 4:30 p.m. We also have minnesotahelp.info. You can do a live chat on that website, or you can research resources on that website if you like to do your own research. Senior Linkage Line also has a really great website. We partner with Disability Hub Minnesota and with Veterans Linkage Line. And then Medicare is a really great resource in itself. Medicare.gov has that plan finder that Kelly mentioned earlier. The plan finder is a really great tool to help you compare your plan options. So not only for Part D, but also for your Medicare Advantage plans as well. But specifically for Part D, you can put in your prescription drugs and it will come up with a comparison of the Part D plans that include your prescription drugs, how much they might cost and on what tier they're in on each plan and at what pharmacies they might be available. So it's a really great tool to use when you're trying to figure out what the best plan for you might be and what that total cost might look like when you're looking at a Part D plan. And then Social Security is also a really great resource. That number there or their website, ssa.gov. Finally, I just want to share a resource for you. The Healthcare Choices for Minnesotans on Medicare includes a comprehensive information on all Medicare plans in Minnesota. I believe there's over 100 different plans, Medicare Advantage plans in Minnesota. So there's a lot to kind of look through and sort through. Again, this is where a Medicare counseling appointment is really helpful. You can sign up for one of those appointments on our website, so trellisconnects.org. We have 27 different site locations in the metro area. Or you can also view this booklet on mnhealthcarechoices.com. You can download a PDF copy of this to review all of the plan options in Minnesota. Well, I thank you so much for your time today. I'm going to give you the senior linkage line number one last time, 800-333-2433. If you have any further questions following this presentation, please give us a call. We would be happy to help.